Hi, we're going to talk about the use of cannabis for depression. This topic has received a lot of confusing press over the past 30 years. You may have heard that cannabis can potentially cause depression. And that's actually one of the myths that have been debunked since we've learned about different strains and what really regulates how your mood's going to be affected by cannabis is the terpenes. That's an important distinction that people didn't know about before. They would just do studies about THC and its effect on people, and in truth, some people became couch potatoes, and it looked like their depression might be getting worse. That's because they were using indicas. We know that now. So if you want to use cannabis to treat depression, you have to use a sativa with uplifting terpenes. These are going to be the citrusy smelling ones, limonene, the piney smelling ones, alpha-pinene, and you definitely want to avoid the skunky smelling ones, the myrcenes, because those will actually make you lethargic. That's what they're supposed to do. So people ask me, can I use CBD for depression? Because I don't want to feel altered from my medicine. And the answer is that CBD has not been shown to really help depression. It's great for anxiety. It can actually help bipolar disorder. It can actually help stabilize your mood, but it's not an uplifting mood manager. So if you have depression from bipolar disorder, then CBD actually might help you. Otherwise, you're going to be taking THC. To get the kind of strain specificity you want, you're probably going to be looking at smoking it or vaporizing the full flower. And I do recommend vaporizers that allow you to put in full flower. They can be portable. There are many of those models out these days. If you want to try using an edible for depression, make sure it's a sativa. And remember, if you're new to edibles, take a small amount. Start with only 5 milligrams, and that's going to last you 6 to 8 hours. So be really careful about your dosing with edibles.